live in 5 seconds. Over to you now, Gillian.
Good evening and welcome to this webinar on the COVID-19 vaccination programme hosted by British Islamic Medical Association, Public Health Scotland and Muslim Council of Scotland. This webinar has been recorded. It will be hosted on the BEMA website and also hosted live on Facebook. If you have any technical issues, please use the chat function and we will try and support you. If you lose your connection, please just dial back in again using the same link as you were sent on registration. I will now pass over to our chair for the evening and just quickly cover a few housekeeping rules. So just can we ask all participants to remain on mute and keep your cameras off throughout the discussion. If you have any questions, please feel free to put them in the chat box as we move forward throughout the webinar. So I'll now hand over to Dr. Saeed Ahmed, Senior Medical Officer for Vaccination, Immunisation and Respiratory Viral Infections from Scottish Government. Thank you.
Thank you, Gillian. Can I add my welcome to you and welcome to the webinar. It is quite an important webinar. As you all know, we have had this significant pandemic with over 4.4 million people affected in this country and with 127,000 people dying in the UK. So the good news is that we got very good vaccines available. Therefore, it is important that people come forward to get the vaccine. However, we are aware that some ethnic minority colleagues are a bit concerned about some of the vaccines. So I hope that after today's webinar or during the webinar, we'll be able to allay some of your concern because you've got a number of speakers and they'll be able to reassure you on some of the areas that may have concern. And after the speakers, we'll have a panel as well, joined by a couple of other colleagues, and they'll be able to answer any queries that you may have so that it can come forward confidently to get the vaccine and protect yourself and your family. I'm not going to steal any thunder from any of the speakers because I'm not quite sure what they're going to cover. So without further ado, I'm going to go straight to Professor Jason Leach, who will start the ball rolling. And I think he does not need any introduction. If you don't know Professor Jason Leach or haven't seen him on the telly, you have been living in a different planet. So Professor Leach, over to you.
Syed, thank you very much. And I think people would benefit from not seeing me quite so much on the telly. I think my mum is the only one still listening and watching, to be absolutely frank. Thank you for the invitation. I'm absolutely delighted to be here. It's been a bit of a mixed day. I've done an Australian webinar. I've done a press briefing with Scotland's journalists and a couple of other live events for other groups, and here we are in the evening. But you are very important because after you, I'm getting a haircut. So that feels like a big step out of lockdown. And the haircut I'm presently sporting is one that my wife did. So it's actually, I think, hair repair rather than a haircut. So my hairdresser will be trying to correct the damage that's been done. So it's terrific to be here. I spoke to the Muslim Council of Scotland's leadership just a couple of weeks ago about vaccination in particular, and they were very keen to get that message out there. And I am equally keen that the single biggest thing you can do to protect yourself, your family, and frankly, to protect me, is for you to get the vaccine, because that's the difference between having diabetes and COVID. So if you have diabetes, that's of course very important. It's important to you. But it doesn't change my life. Your diabetes doesn't affect me. However, your COVID status does affect me. That's what public health is. So the more people who are vaccinated, the more protected we all are. So it's a community intervention, not just an individual healthcare intervention. I think that's absolutely crucial. And I can think of no community that cares more about its broader community than the Islamic community. You have stepped up in this pandemic, both pastorally, if you'll forgive the expression, in a sense of reaching out to the people who you serve, and some you don't traditionally serve. So I've seen the mosques making curries for old people who happen to be housebound nearby and reaching out to those who have suffered horribly from this virus. So let me share some slides quite quickly. I'm not going to talk for long, but I thought I would just share where we are in the pandemic just now, and then a little bit on vaccination. And I'll do that relatively quickly. And I'm very, very happy to take questions whenever it's appropriate to take questions. So that's the virus. You're used to seeing it now. It's a football with spikes on it. That's actually what it looks like. It's an incredible thing, an absolutely remarkable thing. And those little spikes are very important because that's where our antibodies have their effect. This is the Scottish data since the September weekend holidays. So you can see the second wave just after Christmas into January, principally because of the new variant, but also because of relaxations at that time, and a very steep rise and a much more shallow fall. And then a kind of stepped fall in recent weeks and months. You can see we've kind of paused a couple of times and then fallen again. And I'm pleased to say that in the last few days, we appear to have fallen again. We're now below 50 per 100,000 for the first time since September. And 50 per 100,000 is a kind of significant milestone because the WHO say that once you get below 50, your pandemic is controlled. And you can start to adjust the way you manage it. It's not over, but it's controlled. And it means you move into outbreak reduction rather than thinking only at a population level. And that's why you can see us beginning to go for haircuts. It's why you can see further education opening on Monday past, and then more announcements over the next few weeks. But on the other side of the ledger, I'm afraid, is the virus. And the virus continues to, unfortunately, do what viruses do, and that is to mutate. We expect this. Every time it moves from person to person, there is a risk it will change. It doesn't know it's changing. It doesn't have a brain. It's random. And those random mutations, unfortunately, affect us throughout the world because of the nature of our connected world. Now, blue is South African variant in countries. Yellow is Brazilian variant in countries, and stripy is where we've got both. And you can see we now have in Scotland both of those variants. Small numbers, but they do concern us because we're not entirely sure how they behave and how they react to vaccination. Everything so far looks positive, and the Kent variant is our principal problem. So I had touched on the global position. Let me just touch very briefly on what this has meant for the world. This is Tedros, a former Ethiopian health minister, and now the Director General of the WHO. And fortunately for all of us, one of the global public health thinkers, one of the best global public health thinkers, and therefore in the right seat when the pandemic arose. The bottom row of this is just about unimaginable. Nearly 3 million deaths confirmed and 132 million positive cases. I mean, to compare that with something like Ebola, which was huge and a horrible disease in West Africa and was declared as a global public health emergency, not a pandemic, but a global public health emergency, killed 11,500 people and infected nearly 29,000. But to keep this in perspective, the world has never seen anything like this. The WHO have never declared a global pandemic because they didn't exist in 1918. A global pandemic is a pathogen that puts at risk every member of the human race. It's quite a high bar, the global pandemic bar, and we have reached it. People will, I think, for the next 10, 20 years, talk about what happened during and after the pandemic. It'll be a little bit like that old aphorism where you asked your dad or your mum, what did you do during the war? I think people will genuinely talk about this pandemic for the rest of our lives, for sure, if not longer. Now, Syed and others in the government, this is the mission. The mission is to try and reduce deaths from coronavirus. But unfortunately, at the same time, to complicate that, we have to also reduce the non-virus harms to the population. And at the same time, protect those who are protecting us. It would be easier if we just had to reduce death from coronavirus, but it's much more complex than that. We have 4 principal weapons against this disease. We have healthcare, so therapeutics, drugs for those who are sick, intensive care. We don't have particularly good therapeutics for this. We have non-pharmacological interventions, all the things you know, the distancing, the hand washing. And we have test and protect, our ability to find cases, interrupt the chains of transmission, self-isolate the individuals, and then protect that wider community. And that includes all of our testing regimes. And then more recently, we've added our fourth weapon, and that is vaccination. And what we're trying to prevent here is not just COVID. What we're trying to prevent is the harm from the restrictions as well as COVID itself. So 4 harms, and we call it the 4 harm framework. And we have 4 harms meetings in the Scottish Government far too often, but we have to give advice to the First Minister and others about what we should do next at this phase. And that includes COVID harm, of course, the death and horrible destruction that this virus has caused, but also the impact on health and social care services in other ways, so waiting times and mental health challenges. Social harm, loneliness, the loss of education because we closed the schools, and then economic harm, the straight business harm, the unemployment, the people who have lost businesses, the ability to get business support. And the WHO say you should do 6 things as you move out of lockdown, as you move the safety measures away. We don't have time to do this in any detail, but in rough terms, it's control your epidemic. So control the pandemic in your area, reduce the incidence. Make sure test and protect and quarantining is working. Control your outbreaks in workplaces, in places of worship, in other places where people meet, but also in vulnerable settings, so care homes, hospitals, prisons, child centres, that kind of where we put people to live. 4 is about making workplaces safe, call centres, civil service buildings and hospitals, and of course, places of worship where people work there. And 5 is about import and export of cases from other parts of the world, crucial not to export as well as not to import. Europe is now dealing with the aftermath of us exporting the Kent variant, and we don't want to import other variants. And then number 6, one of the reasons why we're here in this webinar is to engage with the communities and make sure they're informed and engaged and participate in helping us with that. So that is a transition to vaccination, and others are going to talk about vaccination too, and I'm very pleased that Syed is here to answer any tricky technical questions, but let me just give you an overview of where we are in terms of vaccination. The first thing to say is that after 200 years, we now know that vaccination is the safest healthcare intervention we have, and it has saved more lives than any other single thing that public health has done other than clean water. It has eradicated smallpox. It has effectively got rid of diseases that killed hundreds of thousands of people, like measles and polio and diphtheria. And here's how that has worked. So when you introduce the vaccine, depending on what the disease is and the take-up of that vaccine around the world, you can get rid of the disease. In some sense, you can't necessarily eradicate it. Smallpox is our exception to that rule. But you can see measles killed tens and millions of people. And in 1968, the year I was born, they introduced the vaccine, gradually rolled out around the world, and then very, very small numbers of cases now, although some resurgence because of the anti-vax community in recent years in some parts of the world. Fortunately, I think we're getting back on top of that. Whooping cough in the middle, and then diphtheria at the top. These are some of the COVID vaccines. We now have the top 3 available in the UK. We gave our first Moderna doses yesterday. I am going for my vaccine tomorrow. Is this Thursday? Yep. So I'm going tomorrow night to the Hydro for my vaccine, and I will take whichever of these vaccines I am offered, and I will take it gladly and with great gratitude for everybody who has made it possible, from the people who made them, the Turkish couple working for a Belgian company who came up with the first vaccine for this horrible disease. There's a fantastic story to be told of the global work of getting this vaccine in place around the world. Now, why do we do it in the way we do it? Why don't we just let anybody make an appointment? Well, we have limited supply, We know we're going to get enough supply, but it doesn't all come on the same day because we're vaccinating the world and the factories are working as fast as they possibly can. And I think this helps people understand why we start with the vulnerable and the elderly. So if you are over 90 years old, you need to vaccinate 40 people to save a life. 40 90-year-olds saves one life. If you're my age, I'm 52, if you're 50 to 54, you need to find 40,000 people of my age to prevent one death. And that's why we do it by age. So this is the priority group. This is phase 1, the 9 groups that we have worked our way through, and we're almost done. We're pretty much there. We've got a week or so to go until we have to have met that target of offering all 9 groups their vaccine. And I'm pleased that I am going tomorrow because I'm in group 9. Then we will move into phase 2, which is what you've heard us talking about over the last few days. And that's where we get into the under 50s. This is our position a few days ago now. This is April the 5th. We've now crossed 50% of the adult population just in the last couple of days. But you can see that the UK is now second in the global race to vaccinate the population. Chile, the US, and if you look further down this list, though, you might be surprised to see some European countries well below 15%. I also looked up Malawi today, just as a comparator. Malawi has vaccinated 0.86% of its population, so less than 1% of its population, and that's true for most of sub-Saharan Africa. So Europe, 15%, Scotland and the UK now 50 to 55%. You get the idea. A huge, huge piece of work for health and social care workers. And this is how we're doing in the groupings. We're almost there. This is a couple of days ago now. This is 6th April. And you can see we're just finishing off that 50 to 54 group. And we've started in the under 50 group, particularly those who have got pre-existing conditions, but now moving down into that group. Now, I thought I'd include this. This is absolutely fantastic news, and then I'm nearly done. A little bit on AstraZeneca and the announcement yesterday, and then I'm just about done. But this is a University of Edinburgh and Public Health Scotland paper, which for the first time really across a whole country suggests the vaccine reduces transmission. So we know the vaccine reduces hospital admission and death. We've known that for some months. This is news. So if the vaccine helps with transmission, that is a big, big advantage. So this looked at 300,000 NHS Scotland workers who had been vaccinated and compared it with people who hadn't been. If you lived with a vaccinated individual, you were 30% less likely to catch the virus. If you lived with a vaccinated individual who'd had both doses, you were 54% less likely to catch the virus. So that could only be because of transmission when you get up to this scale. So this needs repeated. We need to do it on a bigger scale. We need to monitor it around the world, but this is very, very encouraging. Now, you may have seen these next couple of slides yesterday if you watched the briefing in England from the Joint Committee on Vaccination and the Deputy Chief Medical Officer, Jonathan Van Tam. But it's just to make the point about why the Joint Committee announced what it did yesterday. So the regulator, the MHRA, and the European regulator, the EMA, there's an awful lot of acronyms in this world, but the people who regulate drugs and vaccines, they said together yesterday that they now believe that the risk of blood clots is getting stronger. Whether it's real or not, we still don't know, but they said the signal is getting stronger. So they want to put it on the little leaflet that goes in the box to say this is a side effect. They don't tell the country what to do with that information. They just say this is true now. Then we have a group, the Joint Committee on Vaccination, which Syed sits on for Scotland and gets to observe and be involved with and is helpful to us because he's there. The Joint Committee then decides, what do we do with that information? What does that mean for the UK vaccination programme? And Germany will need to decide, and Spain will need to decide, having read the EMA advice, what will their vaccination advice be? So the advice in the UK is, keep going. Everybody over 30, everybody who's got a pre-existing condition, no change. Get your vaccine and get it as fast as you can possibly get it. under 30, no pre-existing conditions, if you haven't had a vaccine, still get one and get it fast, but use an alternative. And we have two alternatives. And that's why we can make this choice. We have Pfizer and Moderna. So 79 people have had this weird blood clot syndrome out of 20 million injections. Nobody has had it after a second dose. It's all been after the first dose. So this diagram shows the serious harm risk on the right and the risk of COVID on the left. And it's very, very important that people understand this. There's a risk-benefit calculation, but the principal thing we're trying to avoid here is COVID. And it's still the most important thing to avoid, even if you're under 30. And that's why we're going to still vaccinate you, but we're going to vaccinate you with one of our alternative vaccines. If we had only had AstraZeneca, if that was the only vaccine in the world, the advice would have been to keep going. That's not the only vaccine in the world. So therefore, we can make choices in this younger group where COVID isn't as big a risk as it is in the older group. That's where we ended up yesterday. And we may well have more questions about that decision-making in the questioning. So that's my introduction to the subject. I'm going to stop sharing my slides and hand back to Syed.
Thank you, Jason. Thank you very much. What we'll do, we'll just go to the next speaker. I've got 5 speakers, and we'll go through all the 4 of them all together, and we'll go through those speakers, and then we'll ask if you have any question, please keep them just now, and then we'll bring all the speakers together, as well as a couple of extra panelists, and we can answer any queries that you may have. The next speaker I have is Dr. Ahmad Mahmood, and he's going to talk about the increasing vaccine confidence during this Ramadan coming. Right, Dr. Mahmood.
Hello, assalamu alaikum. My name is Ahmad Mahmood. I'm a neurology registrar and a clinical research fellow in stroke, currently based in the Queen Elizabeth Hospital in Glasgow. And as Dr. Ahmed was saying, I'll be speaking about increasing vaccine confidence this Ramadan. So a few things that I was hoping to cover, if I can get my slides to work for me. Oh, there we go. So a few things I was hoping to cover, common vaccine myths and how to tackle them, any issues that may come up regarding specifically vaccination during Ramadan, and then just generally addressing vaccine concerns with members of the public and the community, and what kind of messages might work in that instance. Talking about vaccine hesitancy in the Muslim community, I think one of my experiences working with BIMA in this has been that we found that one of the questions that gets posed is, well, what is it that the Muslim community, what issues or factors are there that may be making them hesitant about vaccines? And I think the most important message there is actually it's probably all the same things as the wider community is concerned about. There are a few specific concerns, which I'll come on to talk about, but by and large, it's those same common concerns that members of the community have. So the kind of more sensationalist things like 5G and microchips and so on, those aren't the concerns that most people are worried about. They are concerned about safety and efficacy and some other factors that hopefully I'll cover in the next few slides. I'll share with you some data. A lot of this is UK based or based in England, when we sort of get into the nitty-gritty of breaking down the public in terms of ethnicity and religion, but hopefully some of that to a large extent will be able to be extrapolated to our picture in Scotland. And then lastly, I think just a message to say that avoid viewing the community as a monolith. So the Muslim community, when you use that kind of definition, actually within that there's a lot of diversity, there's a lot of different ethnicities, there's a lot of different languages. And also, people's views on vaccines may not be coloured by the fact that they're Muslim. Muslim may just be one part of their identity, and actually, it's their political opinions or whatever else is the cause of their lack of confidence in the vaccines, and so that may require a slightly different approach. Some data here. Now, this is data from England. And the data is looking not at sort of whether someone was offered the vaccine and then declined, but rather just what are the rates of people getting vaccinated. So the graph on the left is comparing different ethnicities with the white British population, and how much more likely you are to have not received the first dose of the vaccine up to the middle of March if you're from one of these ethnicities. So as you can see, Black African, Black Caribbean, Bangladeshi and Pakistani communities seem to be doing quite a bit higher than perhaps some of the other ethnic minorities, and overall ethnic minorities are less likely to have received the first dose of their vaccine than the white British population. The blue bars at the bottom there are trying to use statistics to say that, well, if we account for things like where you live, what your level of education is, whether you live in an affluent area or a deprived area, if we try and account for those effects, is there still some other effect just purely from ethnicity? And so you can see that if you remove that effect, the blue bars do come down, but there does seem to be some sort of ongoing effect, meaning that people from ethnic minorities are less likely to have received the first dose of the vaccine. And similarly, on the right-hand side is similar data looking at religion, and this is amongst people aged over 70 up to the middle of March in England. And as you can see, Muslim there, so Muslim people in England are less likely to have received the first dose of their vaccine in England up until the middle of March. But this doesn't perhaps really tell us the reasons why, has the message got out to these people, have they been given access, and so on. And so the reasons for that become quite complex and intertwined. There may be issues of mistrust in government, previous negative healthcare experiences, or negative experiences with public bodies. There's issues of deprivation, difficulty of access, language barriers, and so there's many reasons that all tie in and into quite a complex picture about why that vaccine hesitancy may exist. But in terms of what we can do to address that, then these are some of the messages that have come out. In the red box here, in this study, this was the #1 reason why people were concerned about the vaccine, and compared to other reasons that they cited, this was by far more than half of people. This was the #1 concern, that I'm worried about future unknown effects of the vaccine. And that is a completely kind of reasonable and understandable concern for people to have. But encouragingly, the messages in the green boxes here are the #1 or number 1, 2, and 3 reasons why people would be convinced to take the vaccine if they were hesitant to begin with. And encouragingly, these are all things that, as healthcare professionals, as people doing this work, we can very easily show them that these are things that we can show them to be the case. So vaccines will reduce your risk of catching coronavirus. They will reduce your risk of being more seriously ill if you do catch coronavirus. And the safety data, as Dr. Leach, Professor Leach was mentioning, the safety data would suggest that amongst the millions of people that have now been vaccinated, the rate of serious complications is very low. So the vaccines have been demonstrated to a large part to be safe. And it does appear that message is starting to get through. So this is some very recent data that I think was published this week by Ipsos Mori, showing that actually the picture in terms of confidence in the vaccine amongst all sectors of the population seems to have improved. So if you look back in December 2020, both amongst white Britons and amongst the ethnic minorities, there was significant portions of the population that were hesitant, saying that they probably or definitely wouldn't take a vaccine if they were offered one. Whereas as we go through, and I think probably the kind of the excellent effort by the vaccination program and how it's rapidly gone through, and as Professor Leach was showing, how well the UK is doing on the international stage in terms of vaccination, has increased people's confidence. And so the most recent data would suggest that actually in all communities, the number of people that are hesitant about receiving vaccines is getting lower. And perhaps that gap between ethnic minorities and white Britons is now actually very narrow, and negligibly so. So that's quite encouraging, and I know a lot of public bodies and a lot of community groups have been doing a lot of work towards increasing people's confidence in the vaccine, and it's encouraging to see that that message seems to be getting through. So I then wanted to go on and talk about some of the more kind of specific concerns that might be there, and I just wanted to direct you towards some of the really good resources that we have on the website of the British Islamic Medical Association. So if you go to the homepage and click on COVID-19 Vaccine Hub, then you'll be brought to this page, and I'll cover some of the excellent resources that we have here, both highlighting statements that we've issued with regards to the vaccines and some answering some common myths. So BIMA, the British Islamic Medical Association, issued these two position statements on the Pfizer vaccine and the AstraZeneca vaccine, and shortly we will hopefully be publishing one on the Moderna vaccine as well. And essentially, not saying anything really too different to what the public health message is out there, but just reassuring the Muslim community that there is no reason that they should feel hesitant about accepting a vaccination, and all people that are eligible and called for vaccines should hopefully go forward to take those vaccines. And these are the summaries of those statements, and there is a bit more detail in the longer versions for those that might need that. And then the second resource that I wanted to draw your attention to was these BIMA Mythbusters, which have been really, really popular. And essentially in those, we've created kind of short poster type snippets, taking commonly kind of held myths that people are coming across about vaccines. And those have been are available on the website. Some of them have been made into videos, and all of them have been translated. And so far, I think we have sort of up to 18 languages available. So a really useful resource there, particularly if you're finding language barriers with people that you're dealing with. And I'll highlight some of the kind of common ones, and particularly ones that may come up as issues with our community. So when I was saying at the beginning that there are perhaps some specific questions that Muslims may have when it comes to vaccine, one of those questions will be that is it halal for me to have the vaccine? So halal just meaning that is it permissible according to my religion for me to have this vaccine? And again, the British Islamic Medical Association, other Muslim public health bodies, and scholarly Islamic bodies within the UK have all said that all of the current vaccines that are in use are halal for Muslims to take. And again, this is summarized here, but there aren't any ingredients in there that should make Muslims hesitant. The AstraZeneca vaccine does contain a very small amount of ethanol, but this isn't to a level that would be considered intoxicating or anything else, and the negligible amount would mean that again the religious permissibility of the AstraZeneca vaccine isn't in doubt, and it's halal for Muslims to take that. So that can be a useful thing to explain to someone who might be hesitant for that reason. And then secondly, probably actually the most common discussion I have with friends and so on is about safety of the vaccine. I think really that's what people are concerned about. And again, there's Mythbusters there to talk about some of these issues. So I know that DNA and modification of DNA seems to be a kind of common concern, and a kind of simple explanation about how the Pfizer vaccine works in terms of using mRNA, and really there being no kind of logical ways to how that could manipulate a person's own DNA would address that concern. Vaccines being approved very quickly. Well, I think those of us who work within healthcare would understand the massive global effort that's gone into COVID research trials. I myself in my job work in research trials, not in COVID research trials, but in other research trials. And so I could see, a lot of the speed with which things were done wasn't cutting corners, but was rather removal of any barriers with absolute speed, so that the vaccine trials could proceed as quickly as they could. And lastly, any kind of irreversible side effects. So the reason we quote this particular figure of 3,000 is that there was kind of popular campaign that spread through WhatsApp very quickly, where particular individuals were taking data from the vaccine trials and quoting this figure of 3,000 and saying that these people had suffered irreversible side effects, when actually it was simply a case of misinterpreting the data that was there, and 3,000 people may have come to some temporary reversible side effects. We know that, kind of common things, a sore arm, whatever else, may be common for lots of people. But in terms of severe irreversible side effects, then the number of those was far less. And lastly, I think one issue that will come to, particularly as we come down the age groups in terms of the vaccination programme, will be whether it's necessary. So elderly population will have been acutely aware of the threat that COVID posed to them, but younger, fitter, healthier people may presume that actually, I'm not one of the people that needs the vaccination to protect myself. And I think that comes back to what Professor Leach said in his presentation, that me being vaccinated protects you, and you being vaccinated protects me. And I think again, my sort of dealings with our community and explaining some issues around vaccination, that message of protecting one another, and that the message of the very severe threat that COVID itself has posed to the community. And I've not gone into the data here of the really devastating effect on ethnic minority communities, specifically with COVID, but that has been widely talked about before, and I think those are the kind of messages that will hopefully allay any concerns that people have in terms of deciding about that risk benefit between vaccination or not. And then lastly, I just wanted to come on to talk about vaccination during Ramadan, and if that was going to pose any particular concerns. So Ramadan, I know we have quite a sort of mixed audience here, but just to sort of briefly explain that in Ramadan, Muslims that are fasting would have no food or drink from the early hours, so in Glasgow around about 2-3 o'clock in the morning, until sunset, so 8-9 o'clock at night. And you might imagine that something that in itself sounds quite grueling might be quite difficult for a lot of the community to do, but actually the research into this in the past would suggest that the vast majority of Muslims do observe Ramadan, and one of my kind of interests is Ramadan and people's health and how people with chronic illness might manage during Ramadan. And I think our findings in that very much are that most people are actually very keen to fast. It's very much of a community occasion when Ramadan comes around, and they were very reluctant to miss out on that. So any opinions that they have about being vaccinated during Ramadan may well be coloured by those thoughts. So questions that they might have: is vaccination allowed during fasting? That may well be linked into their own experiences with medication. So if they take oral tablets, for example, they'll know that in a kind of regular fast, particularly longer fast, that they might need to speak to their doctor about slightly changing the tablets that they're on, to allow them to take the doses at the appropriate times, because they can't take oral medication during their fast. So they may wonder about that. They will wonder that, am I going to have side effects that mean that I can't fast? And ultimately may have an attitude of, well, why don't I just wait? The Ramadan's a month. I've waited so long for a vaccine. Why don't I just wait a little bit longer? So brief answers, questions, and again, these, if you wanted some resources around this, there are statements on the BIMA website. But firstly, to say that vaccination doesn't break the fast. So if you're fasting and you receive a vaccination, it doesn't break your fast. It doesn't affect your fast in any way. You can continue fasting that day. In terms of side effects, well, you can reassure people that in the majority of people, side effects are mild. They don't come on straight away in any case. So even if you're having your vaccination that day, you can continue fasting and probably wouldn't really expect to find that you have any side effects if you are going to have side effects on the same day, but usually kind of in the 24 to 40 hours afterwards. And if those side effects are significant and you require paracetamol or otherwise to manage those, then you would not fast for however many days you took to recover, and any fasts that you weren't able to keep, you could make up at a later date. And most patients will be very familiar with that. So, you know, particularly if people that are experienced in fasting will know that they will have had times in their life where they've become ill during Ramadan for whatever reason, and they've had to stop or delay fasting for however many days, and then made that up afterwards. And then lastly, dealing with the question about, well, why don't I just get vaccinated after Ramadan? Well, you know, I think there you need to explain to people the same kind of discussion that we had about delays in vaccination exposing other parts of the vulnerable population to extra risk, particularly as we hopefully come through easing of lockdown and moving through the phases and interacting with each other all a little bit more. So this is a resource statement that BIMA have issued regarding the COVID-19 vaccination and fasting, and you can find that there on our website as a resource as well. And then lastly, you know, what can I do as somebody that may be dealing with members of the community, that may be a healthcare worker vaccinating Muslim patients? I think firstly, my message is to address your own concerns. As I say, most of the concerns that people have about vaccination aren't sensationalist. They're not kind of wild theories. Most of them are legitimate concerns that with the right explanations and access to the right research and data can be reassured. Connecting with individuals and exploring their concerns and dealing with those concerns can often, you know, that positive experience with a healthcare professional or otherwise, or a trustworthy voice in the community can turn that situation around. So I know that you know, some GPs, when it came to patients within their surgeries who were electing not to, a simple phone call from the GP to say, what is it you're concerned about? What can I do to allay those concerns? In most cases worked, and those people would then go on to accept the vaccinations. So I'll stop there. If there's any questions, I don't know how we're doing for time. I've not got a clock in front of me.
Thank you, Ahmad. I think what you'll do, as I say, we'll take maybe a question right at the end, if it's okay.
Yeah, that sounds perfect.
Okay, thank you, Ahmad. Good to see there increasing confidence, you know, among I think minority about the vaccine. Now we have to translate the confidence into action by getting good vaccine uptake rate. Our next speaker is Dr. Sahira Dar, who is going to address the issue of fertility, pregnancy, and breastfeeding. Very important topic area as well.
Good evening and Assalamu alaikum. Thank you for joining us this evening. It really is an honour that so many of you have tuned in. So when we were thinking about what we wanted to talk about in this webinar, we were mindful that we're going into a cohort of much younger people, and there'll be certain issues that are coming up in this younger population. So I'll be talking briefly. I won't take up too much time because these are quite simple concepts, giving some key messages around fertility, pregnancy and breastfeeding. So around fertility, not much to say apart from that. There's absolutely no evidence to suggest that COVID-19 vaccine affect fertility. We know that a number of women that had vaccines in the trials have since become pregnant and have been absolutely fine with it. Didn't affect them getting pregnant, and they've had no issues. There was a very early on working theory, and this is where this sort of myth or issue came from, that the vaccine cause a protein, an immune protein to be made that may affect fertility and may cause fertility problems. However, that's not been supported by evidence. There's no evidence to suggest that that is true. Furthermore, people that have had COVID-19, that have had the infection, also developed that same antibody, that same protein, and they've had no issues with, there's no evidence to suggest that they've had any issues with fertility or problems with that. So straightforward, no evidence for any fertility problems. Going on to pregnancy, so I'll spend a little bit more time around pregnancy. So currently the Joint Committee of Vaccination and Immunisations advise that pregnant women that are at a high risk of exposure of the virus, so those are your healthcare professionals, your frontline workers, public facing jobs, social care jobs, those women and those that are high risk, that have high risk medical conditions that place them at a high risk of complications of COVID-19 should consider having the COVID-19 vaccination in pregnancy. We're going into that cohort of younger patients, so a lot more women will be invited for vaccination that are pregnant. Those will include those that have chronic disease, but also those women that have something called gestational diabetes, and that's diabetes that affects them only in pregnancy, so it's a pregnancy related issue. They will be called, and also women that have a high BM, a high weight, they will also be invited for the vaccination. And these are women that are generally quite healthy out with the pregnancy or considering themselves to be well, they will be invited. So this discussion is quite pertinent and important for them to be having. It's important that we individualise this discussion and individualise the risk benefit discussion with these women. The benefits and risks of COVID-19 vaccination in pregnancy should be discussed with a trusted healthcare professional, and it should take into account risk factors such as ethnicity, high BMI, and also age. This discussion should also acknowledge that there's no known risk associated with the current non-live vaccines that we use in pregnancy. That includes the flu vaccine, includes the whooping cough vaccine, which we use in pregnancy, and COVID-19 vaccines are also non-live vaccines. However, there is no specific data for the safety of the COVID-19 vaccines in pregnancy. And the reason for that being, in the very large clinical trials which were done to show that COVID-19 vaccines were safe and effective, it did not include pregnant women. That is generally because of ethical reasons. This means that there's limited information about the effects of COVID-19 vaccination in pregnancy. A very small number of women have become pregnant after they received the vaccine in the trial. However, because the numbers are so small, they can't really be used in evidence. The vaccines were not tested in pregnant women, therefore we also cannot comment on how effective they are. We don't know if they are as effective in pregnant women as they are in other adults. However, there's no reason to think that the vaccines will not protect pregnant women as effectively against COVID-19. And there's no reason to think that vaccines will have any worse side effects in pregnant women. It's important to say that the vaccine doesn't contain any ingredient that is known to be harmful to the pregnant woman or the developing baby. There have actually been studies done in animals to look at the effects of pregnancy, and they have shown no evidence that the vaccine causes any harm to the pregnancy or the developing fetus or to fertility. I mean, that's really pretty much everything in regards to pregnancy, and women don't need to avoid becoming pregnant when they've had the vaccination. A little bit about breastfeeding. It's important. So women that are currently breastfeeding, if they're invited for the vaccine, they should not stop breastfeeding in order to be vaccinated. There's no known risk in breastfeeding for women that are getting vaccinated. There's nothing included in the vaccination that can cross into the breast milk, and yet there's lack of safety data for the specific vaccinations in breastfeeding, but we know from other vaccines that is the case. There's no plausible mechanism by which the vaccine ingredients could pass on to breast milk. So again, in terms of fertility and breastfeeding, there's no current evidence to suggest that there's any issues. And when it comes to women that are pregnant, that discussion needs to be individualised. Risk factors need to be taken into account, and that discussion should be had ideally with a trusted healthcare professional to come to a joint decision. Another something extra just in regards to pregnancy. The benefit of getting vaccinated in pregnancy is that in the later stages of pregnancy, women are at an increased risk of becoming seriously unwell if they catch COVID-19. The number is small, but the risk is severe. And if in those women, there's an increased risk that the baby is born prematurely, and that leads to lots of other long-term health complications. And that raises the question of when should we vaccinate women that are pregnant? So that's something that is still being discussed. But the main take-home message from this today is, if you're invited to get vaccinated and you're pregnant, or want to get more information and you're pregnant, you need to have that discussion with a trusted healthcare professional, taking into account your risk factors and your health status at the time, and also the stage of pregnancy that you're at. So I hope that helps cover those areas, and we can obviously look at more things in detail at the end.
Thank you, Dr. Dar. Thank you. Just to say that the latest recommendation, both from the Royal College of Midwife and the Royal College of Obstetrics and Gynecology, now recommend that all pregnant women should be considered for vaccination, because we now have more data, as you correctly said, that it hasn't shown any problem, but unfortunately we haven't had much data to be able to completely reassure women. But certainly more data coming through suggesting that it's probably completely safe. So they are recommending that all pregnant women should be considered for vaccination. So that's good news for pregnant women, because it not only affects protecting the pregnant women, but also affecting the unborn baby as well. Okay, our final speaker is Nuala Healy. Now, I don't know whether Nuala can join us, or is it Gillian who's going to present?
Evening, everyone. So yes, Nuala is unfortunately, hi there, Nuala is unfortunately having some technical issues. So I'm Gillian Phillips and I'm Health Improvement Manager at Public Health Scotland. So I work as part of Nuala's team. So I'll take you through the slides on Nuala's behalf. I'll also take this opportunity to encourage you that if you have any questions, please get popping them in the Q&A box as we head towards the end of the presentations, and it'll be great to have a list of your questions. And as I talk through the slides, I'd really just like to encourage you to think about the materials that we're showing you and how you can use them. How can they be of use in your everyday life, at work, or your daily conversations? Can you act as a peer advisor using the trusted sources of information? And if you could just move to the next slide, please. Thank you. So people are currently being invited to attend vaccination appointment by letter. So for many of you, this might be familiar if you've had your letter through the door, and the letter itself contains an information leaflet about the vaccination. And the leaflet is also available in additional languages and formats online. So we're really trying to make this information as accessible as possible. And the letter itself includes information on how to reschedule your appointment. So if the appointment that you're given and allocated doesn't suit, you can simply phone up the helpline, the phone line, and go online to rearrange your vaccination appointments. The process does vary by health board, but there's somebody there who can help you with that. And you'll see as well on this slide that we have QR codes. And just to remind some people that if you're not familiar with this, you can simply take a picture of the QR code with a smartphone using the camera, and that will then bring the information up to help you rearrange and to follow the information. So next slide this shows you the adult information leaflet. And again, it comes in a number of different languages. And what we have to do is just try and make sure that we get that information out to the community. So again, I'm keen to have this information available in different sites, and it has information on common side effects. So again, we really want to reassure people that what they're experiencing is to be expected, that they're common side effects. And we're hearing some people say, they're a little bit unexpected, they're a little bit thrown by some of the side effects, and it's just to reassure with the correct information in this leaflet. There's also a list of any reasons why you shouldn't attend or receive the vaccination, any contraindications, and there's the reassurance about vaccine safety, which again is very important, especially with the constant Sky News and BBC News that's popping up just now. So it is a worrying time for people, and we just want to reassure them in terms of vaccine safety. So the next slide, please. Again, if this is the NHS Inform website, which is for the public, and we have information on COVID-19 vaccine, and it lets you see the different leaflets that we have, but also the formats. So not only is the leaflets available in other languages, but they're also available as audio format, easy reads, and large print, and British Sign Language. So we're really just trying to make sure that that information is accessible. And next slide, please. Thank you. So yeah, this just lets you see the language, the different languages of the materials. And again, as I said, I'm really keen to get these out in communities so that people can have that information to make a decision before they come along. And it's not a case of they get the information in their language as they come along. So if you have any thoughts on that, where you would like to have them, if you have a business or if you have a, you know, a kind of a local hub, we can have that information available to you. And you can see the range of different languages there. So that's great, thank you. So this again just shows you the range of different languages that we have on the different topics that we've heard about tonight. So a really good overview of, you know, information about the vaccination during pregnancy. And you can see we've tried to make it much more easier based on feedback in terms of putting the information together by languages. We have had feedback about some of the material being quite hard to navigate if you know you have to navigate your way through in English to find your way to these languages. So we're trying to group it and make it as accessible, and it's something that we'll always take feedback on and try and improve on to improve the experience for anyone trying to find this information. And just next slide, please. Super, thank you. So again, not only are there leaflets available, we have some videos to show you what to expect. So there's videos about what to expect at the very large vaccination sites, because we know it can be daunting. You know, if you're going along to, you know, the Hydo and you're thinking, what will I expect? How will I know where to go? How will I park? So there's lots of information that's available, and that's on YouTube. So hopefully, again, that's something that after tonight, we can get sharing that information and take away any people's concerns that they might have prior to attending for their appointments. And next slide, please. Great. So as I mentioned, common side effects is something that we're keen to make sure that people are informed about. Patients are given this leaflet after the vaccination. It explains the side effects that you might experience after the vaccine and how to treat them and when to seek further advice. There's more information on NHS Inform, and patients can also report any adverse effects to the MHRA using the online link. Next slide, please. Thank you. So we have lots of different social media messages, and here you'll see there's some different images that have been available in the first Roll Up Your Sleeves campaign. And as we move towards the next stage of the campaign, there will be much more diverse images and also really trying to reflect the younger population that will be getting invited. As we work our way down the priority list. So there's a range of materials. So if you have Facebook pages, you know, if you have Twitter, these are the kind of things that by sharing these, we'll get people talking and we'll get using the trusted sources of information as opposed to seeing some of the myths that are available online. Next slide, please. Thank you. So as I mentioned, yep, this is a campaign. So hopefully these faces, you'll recognise them from the campaign from the TV. The next stage will be launching later on in the month. So there'll be lots of opportunities to get talking to your peers and have a think about when you can, you know, have a chat. And the next slide will show you some information that we have. Oh, sorry, that BIMA have as well. So BIMA, just wanted to flag up a reminder. I know Ahmed covered some of this. So just that there's some great information and we're passing this information to the NHS Inform helpline to make sure that any answers, any questions that are asked, that we have the answers available. So lots of great resources here, and it's something that hopefully we'll try and just get this information as available as possible. And the Mythbusters is fantastic. That's something that is well commented on when I circulate you know, the information to support vaccine confidence. And next slide. So here you can see we have the statement of facts, which have just been developed in partnership with the Scottish Refugee Council. And these are in the format of videos. And again, it's to try and make them more accessible. So the videos, it's a project to try and get the appropriate messages out into different communities. And the statements of facts have been translated into different languages. So the Scottish Refugee Council have worked with community groups to get the statements read by respected individuals of that community. So we'll send out the hyperlinks as well as part of your follow-up to tonight's webinar, and make sure that these information videos are available. And they've been translated in lots of different languages. And we recognise the value that if information is in the language that you speak, your mother tongue, that it will be much more effective, that people will engage with it and take on board some of the key messages. So really trying to recognise that and build on it. And the next slide, please. Sorry, just to kind of summarise, the information that we spoke about is on NHS Inform. So you'll see that on the COVID vaccine page with lots of languages and formats. As I mentioned, there's a helpline and there is an interpretation service available. You just have to, the process that's available to, you have to arrange a callback to the number that you're ringing from. So again, you have to just initially tell the operator what language you need, and then you will get a call back to go through. And here you'll see a toolkit to support informed consent. And this is something that, again, will get sent out as part of your follow-up to tonight's session. And it has information, so it will act as an aid to conversation for you to have lots of information on eligibility, appointments, languages, and all the myths that we've been chatting about tonight. So that toolkit will be made available. And I'm conscious, I'm really keen to now get you a chance to ask your questions. And so I'll stop talking there, if that's okay, and we'll hand back to Saeed for the panel section. Thank you.
Thank you, Gillian. Thank you. Maybe I'll invite all the panel members to join me as well, right on time. And I did not have to interrupt anybody at all. Okay, so we got all the speakers, but we also joined by, I believe, Dr. Omar Afzal and also Henry Prempe as well. Okay, so Gillian, there are some Q&A, there are some questions posted. Should I just go through those? Or first one is, when I had my AstraZeneca COVID vaccine, I saw the ingredient recombinant replication deficient chimpanzee adenovirus. Please, could you explain this? So the question is that when the person went to see went to get the AstraZeneca vaccine, saw the ingredient being recombinant replication deficient chimpanzee adenovirus. So look, someone could explain exactly what that means. Anybody want to take that on? Okay, I'll have a go. Okay. Sorry, someone.
Do you want me to take a go, Said?
Go on.
Okay, that's an adenovirus vector that's used for transporting the genetic material required to produce the S-spike protein into the cells. So what happens is that this particular viral vector cannot replicate. It goes into the cells, introduces the genetic material, the cells produce the S protein, which acts as the antigen, and that antigen then causes the body to produce antibodies so that when the real virus appears, the body has the antibodies prepared to attack the real virus. The chimpanzee vector virus that's used, the adenovirus, it's not harmful. It cannot replicate, as the name says, and it dies off soon after doing its job in getting the genetic material into the cells.
I think it's important, Syed, just to be clear, it's not a bit of a chimpanzee. It's a virus that infects chimpanzees. Just like a human virus infects humans, this is a virus that infects chimpanzees and not humans. So it's not a suggestion that it's anything other than a virus that infects chimpanzees. And Henry is absolutely right. It's completely deactivated. It is no risk. It's just a mechanism we use to get you vaccine.
So it's about, as Jason and Henry said, is the virus that caused common cold to chimpanzees. It simply acts as a carrier of the genetic material into our body to produce the vaccine. So that's basically it. Okay, next question is, where does Scotland stand with the vaccine visas? Maybe for Jason, this one. Where does Scotland stand with vaccine visas?
Yeah, so this is a controversial area. I think in the end, this is a decision that will be made by politicians, not by clinicians. And I think that's probably the right territory for it to be made. I think some things we know. So international travel is already needing, to some countries, a vaccine, evidence of vaccine. And to get to Scotland, you need COVID certification. You need a test to get to Scotland. So broadly, COVID certification is going to become a thing. We're going to develop a digital solution to allow people to be able to do that if they want to fly to a country that requires vaccine status or a test. The more tricky bit is what vaccine status will do to you in your own country. So there are examples now in America where you can do more, in Israel where you can do more. We haven't done that. Politicians in general appear reluctant to take that on. So you could go to X if you have a vaccine. That's really difficult. It has huge inequalities issues. What do you do with young people? What do you do with people who can't be vaccinated? What do you do with pregnant women who choose not to be vaccinated, like Sahira's examples? So you end up in a place where it's a little bit tricky for the clinicians. I think the politicians will have to make decisions for the UK.
Thank you. Thank you. The next question is, I think Sahira said individual risk assessment should be done in pregnant women, but did Said say that obstetrics body were saying all pregnant women should get? Please, can you clarify? So I think, so what Sahira basically said was that there should be individual risk assessment made for pregnant women, and particularly high-risk women, those who work in the healthcare sector, or women who got other risk condition will benefit from the vaccine. And what I said was that the latest information from the Royal College of Midwives and from the Royal College of Obstetrics and Gynecology is that they want to be much more permissive, which means that every pregnant woman should be considered for vaccination. Again, they need to discuss with the healthcare professionals the benefit of the vaccine, and they have to make a decision themselves. So I think there seems to be much more permissive approach or permissive attitude from the professional bodies coming through. Sahira, do you want to add anything else?
Yeah, I just wanted to add that it has to be a risk assessment for that individual woman, and we need to take into consideration ethnicity, age, and weight, which may not be risk factors that women would normally think about.
Yeah. So all these issues need to be considered into the equation, and obviously whatever decision is made, it will be a joint decision made by the woman herself and the healthcare professionals. But on the whole, it is the wish of the woman herself with the information that was given to the woman. Okay, next question is, how can we tackle the lack that the vaccine centers don't using language line? How can we tackle the issue that the vaccine centers don't using language line? So maybe the question is about how can we tackle the issue that people think they're not using the language line? Anybody? I don't know. Gillian, do you know anything on that?
Yeah, I can certainly take that one. It's something that I can go back and look and see in terms of the health boards, how they're actually delivering the vaccination programme, and look to see where it's getting used and it's getting used well, and get some good examples. And just what we're trying to do is almost do a bit of an assessment just now in terms of making the vaccination programme inclusive. So that is certainly something that Public Health Scotland can support health boards with in terms of, you know, the recommendations to have an inclusive programme. So that's something I can follow up after tonight and try and just share the good practice around, you know, using the different interpretation software that's available.
Thank you, Gillian. Oh, that's a big question. It's like an essay. I currently work with the population of Syrian refugees in North Ayrshire. can we get a number of the leaflets in Arabic to hand out to our families? So someone who work in Ayrshire looking for some leaflet in Arabic. So maybe Gillian, you could probably pick that up. Name called Joe Clemens after the seminar webinar.
That's fine. I'll follow up, Joe. Thank you.
Other question is about vaccine centers not utilizing translation support. I think that's already been covered as well. So Gillian is going to pick that up after this webinar. Okay, I think that was it. Basically, translation and leaflet.
Can I just flag up, there's a question came through on the chat function that I think is really important we cover tonight. So
Well, then,
the question is about drinking following vaccination and fasting, that the nurses on administration of the vaccine advise you to drink plenty of water to avoid dehydration. So how do you recommend Muslims who are fasting cope with this? So I thought that was really important.
Yeah, thanks, Julie. I was actually just in the process of typing the response to that, but I'll do it here. So yes, so dehydration can definitely be an issue for fasting patients, and we've seen in the past issues with problems that arise from dehydration, kidney stones, constipation, these kind of things. So I think the message to Muslim patients has to be that you really have to ensure that you're taking enough fluids during the hours where you are eating and drinking. So you know, you'll have, depending on the length of the fast, you should have kind of 5 to 6 hours, possibly longer, to take on fluids and regularly, from experience, regularly taking on fluids. So not taking on, you know, a litre and a half as soon as the fast opens, or a litre and a half just before your fast begins is probably not going to help. But regularly spacing out the fluids that you're taking through the evening and the early morning, and most Muslims will be familiar with sort of changing up their routines a wee bit, so they may well have some sleep whilst the fast, you know, in the evening before the fast opens, and they may be awake later than they usually would, because there are extra prayers and so on that we do during Ramadan. So they can expect to be awake for much of that time, and you know, having bottles of water with you and ensuring that you're hydrated, not just for people that have been vaccinated, but for your health in general, is really important.
The only other thing I would add, that because a lot of the health board offer clinic from 8 in the morning until 8 in the evening, so maybe that they could maybe try to make an appointment kind of later in the day, closer to when they're going to break their fast. That might also help them as well, so that they don't have to wait too long after vaccination before they break their fast.
Super. Just before we go to the next question, can I just flag that the poll is now live? So the poll box down at the very bottom, we just want to get a few questions to see how useful the webinar's been. So just before people start dropping off at the last few minutes, and then we'll let some of our other panelists get a chance to have a chat. So that's the last from me. Thank you.
So do you want to take to the poll now?
So the poll's live, so if participants can just go to the poll, but we can keep doing questions
okay, right,
and work our way through. Thank you.
Okay, so could you please kindly complete those polls so that it is useful for us to know exactly whether the webinar was useful to you, so we know how to organize future webinars as well. Now, next question is, are all the slides going to be made available by email to refer back to our own leisure and summarize for our community? Now, I didn't know the answer is. Are these slides going to be made available to the participants?
If that's okay with all the presenters, I can send out all the slides along with the follow-up information and any questions that we don't get a chance to answer tonight. I can send.
So I suggest that Gillian afterwards email the presenters, get their permission, and if possible, send it to them if they are around. Okay. What else? Next one is, with regard to other language, can you make the patient information leaflet of the vaccine Pfizer or AstraZeneca people receive this also available in other languages? With regards to other languages, can you please make the patient information leaflet of the vaccine available in other languages? The answer is yes, I presume, Gillian. Patient information leaflet in other languages?
Yeah, that's fine. Again, I think it's just mostly trying to get awareness out of how to access that, so that information is available. So again, we can send around the links, and that will be part of the toolkit as well, that you can access that information.
Okay. Next question is, will the webinar recording be available in the NEST website? I presume the answer is yes. Gillian?
So the webinar recording.
So the webinar is being broadcasted live on Facebook page of British Islamic Medical Association. It will be uploaded on the YouTube channel as well.
And
I wonder, Omar, could we possibly get it on the Scottish, the Muslim Council for Scotland? Is that something we could probably do as well? Host the information there? Is that?
Yeah, absolutely.
Yeah,
we'd
super.
be happy to do that. Yeah.
we can let all the participants know exactly how to access it then.
Great.
Okay. Where are we? Oh, working with community influence leaders and giving clear. Yeah. I'm not sure that there is awareness that individual can access interpretation helpline. Again, the same thing. Vaccine effectiveness against the Brazilian variant that seems to be currently sweeping across Brazil. Are the vaccines currently used in the UK effective against the Brazilian variant that seems to be currently sweeping across Brazil? Anybody want to take that one?
So in summary, yes, so far so good, but we don't know for sure because we haven't been able to do big trials, because we haven't got a big vaccinated country with a lot of Brazilian variant. But it would appear that, yes, there isn't a significant vaccine escape with the present variants that are in the world. But it's a very, very important point, and it's one of the reasons why we can't just suddenly open.
And the other thing is that a lot of the variant seems to be that at least the current vaccine provides protection against severe illness, which is the reason why we want to make sure that we vaccinate people, because as you all know, all the vaccine actually provide nearly 80% protection against hospitalization after one dose, and nearly 92% protection after 2 doses, and nearly 100% protection against severe illness requiring ITU admission, which is very, very good news indeed. If someone does not want AstraZeneca vaccine as their second dose, can they request an alternative? I'll take that one. The answer is no just now, mainly because we have not done any clinical trial to see whether we can mix and match vaccine. There are clinical trials underway. And if if these trials are successful, there may be possibility that if people had side effects after the first dose, they may be provided an alternative vaccine. But at the moment, the answer is no. If people do not want the AstraZeneca vaccine, can they have an alternative? Again, unless there are significant contraindication at the moment, there is no choice made available in this country, because all the vaccines are thought to be equally effective. Are we expecting a third jab as a booster in the winter? So the question is there going to be a booster in the winter? I can answer it, but anybody else want to take it first?
So the answer is probably. We don't know for sure. Probably autumn, winter, there will be a booster, and it will take account of some of those new variants, but we can't know for sure until we know how long immunity lasts, because we haven't had the vaccine long enough and the disease long enough to yet know what immunity means. But probably most of the mainstream scientists think we will need a winter booster.
Yeah. So we are basically waiting to see how this the pandemic evolve over the next few months, and how we are monitoring, as Jason said, monitoring the effectiveness of the vaccine to see how long the vaccine efficacy will last as well. Now, Gillian, have we answered most of the question, or have we got anything that?
So there's still quite a few questions, but I'm just conscious of time. So what we'll do as part of the follow-up, we'll make sure that every question has got a written answer. So even the ones that we've already answered, just so that you've got a nice account of the accurate information. I'm just conscious not everybody got a chance to speak as part of the panel. Is there anything in terms of the questions that anyone's?
What I'll do, Gillian, I'll ask each of the panel members if they want to say any final words.
Thank you.
In case they, they've been missed out. So I'll start with Professor Leach. Is there anything else you want to pass on to our viewers, Jason?
Only very quickly, Syed, two things. Number one is to thank you for all of the work you've done to keep the country safe up to this point. And number 2 is please, please, please use all of your engagement powers to get as many people to come for the vaccine as possible.
Thank you. Henry?
Just to highlight that the maximum benefit from this vaccine will be derived from getting as many people vaccinated as possible. So we should try our best to make sure that not only do we get ourselves vaccinated, but we get our family, our friends, encourage everyone to come forward and get vaccinated.
Thank you. Dr. Sahira Dar?
Thank you for everyone for joining us this evening. I think we all have the same concerns and we all have the same aim, and that's to keep our communities safe. So really appreciate everyone that's come on today.
Thank you. And Omar Afzal?
Yeah, I think the key points that we should take away is that we all need to do what we all can within our spheres of influence to encourage people along to get the vaccine. And I think the important key message certainly that's come out from today is that taking the vaccine is more of an altruistic act, and that's a key message that we need to hammer home for people as well. It's not just for the individual, but it's for the good of all society. And as Professor Leach has said many times, it's gonna take all of us to keep all of us safe. So that's really the key messages that we need to be hammering home.
And I think also importantly, your friend and family, particularly among the sort of Asian ethnic community. We know that we live in a bigger multi-generational household. Therefore, it is important that we do protect our wider family members as well. And finally, Dr. Ahmad Mahmood.
Yeah, just to thank everyone for attending. I know a lot of you are working, certainly from the questions it seems, with patients and delivering vaccines. So I hope that the resources that BIMA has that I highlighted are useful to you. And if there are any ongoing issues or queries, more than happy to help where we can.
And before I hand over to Gillian for any final arrangement, I would like to thank you all for attending this evening. And I also like to thank the panel members for their presentation, as well as answering some of those questions, and also those behind the scene who have made it possible, particularly colleagues from Public Health Scotland and also from BIMA for organizing this seminar and also making this the webinar possible. And hopefully it will translate into more Muslim community coming forward and protecting themselves against this extremely serious illness as well. So Gillian, is there any final arrangement about the webinar and how people can access any of the material before we close?
Yeah, so we have your email address from when you registered for Zoom. So what you'll do is you'll get a follow-up email after the event with all the supporting information, the slides that we have agreement to share, the links to the supporting resources, and I'll have my contact details so that if anyone wants to follow up with me after this event, that we can keep this conversation going. And it's the start of I guess, a national comms plan, that we're not going to, the conversation doesn't stop after this webinar. We'll keep this going and we'll make sure we've got answers to all the questions if we didn't get a chance to do your answer tonight. So just a massive thank you to all the panelists for your time and your input. I know it's been a very busy week, so thank you very much. And thank you to everyone for dialing in.
And thank you all. We are going to close the webinar. Thank you.